We welcome Dr. Jeff King to the studio with King Clinic, and it's always a pleasure. And today we're going to talk about, I'm going to change the words you gave me. We're talking about the difference between being healthy, maintaining your health, as opposed to treating symptoms which aren't getting at your health so much, right?
That's right. That's right. Health, by definition, is optimum function, functioning at your optimal level, not necessarily the absence of pain or symptoms. Now, most people are only conscious of their body when it's dysfunctional, you see.
Like because we learn to live with the pain, we just accept it because it's always there?
Well, yeah, and we only seek counsel or advice when there's a major crisis.
Because we all deny that there could be something wrong.
Sure, we're just disengaged from our body. We're not very interested as Americans here in the West. We just couldn't be bothered. We're willing to spend, $5 grand, typically a year or two, on the maintenance of a machine, a car, that we'll be rid of within 10 years, but not a dime on our body. It's
this is very interesting. Yeah, because you're just saying couldn't be bothered. Whereas Eastern, in Asia or whatever, aren't they very, very focused about their health care and their spiritual well-being and all that?
Sure. Most countries that aren't third world, I should say, are fairly interested in those concepts because, number one, healthcare is very expensive, or I should say symptom treating is expensive, and health maintenance is quite cheap. All it asks of you is to be responsible, I think, as a human being, eating well, getting the stress off, having checkups from your regular provider or health coach. I guess that's kind of the concept I wanted to drive home today. I've noticed in my own practice, practicing for 4 years since I've been out of school, I've realized that instead of patients, really I have practice members. Whereas these people that originally come to me are in crisis. They have a back issue that's killing them. They can't lift their shoulder. Their knee is swollen. They can't bend it. That's how we start, right? And then they stay with me for a while through treatment and whatnot, and they get better. And then they start to learn some things, ask me questions. I don't know, maybe it's my sparkling personality that starts to... Yeah, that's it. It just sort of comes out, right? And they start pitching me with questions. Well, what do you think about this? What do you think about that? So I tell them. Or if I don't know, I say, I don't know, but I'd love to find out for you.
So it makes them be responsible for their own health then.
Yeah, we kind of develop a partnership, and they become more of a practice member, and I sort of become positioned as almost like a health coach. Just like I taught your astute audience long before about the concept of health being a triad. 3 components: mechanical or physical, chemical or the biochemical component of the body, and the mental part. And all those 3 parts have to be in balance and functioning, or you start going down. And that's what disease is.
Right. But there's also a resistance, I think, in this country to look at that and go, that seems a little, voodoo-like, or, it's a little too much out there.
It may be.
And I think we race through our lives and throwing aspirin and ibuprofen at that pain because we don't have time to stop and really deal with it.
Right. Until they're forced to.
Yeah.
At 50, 60, 70 years old and say, oh my God, do something. That's generally the typical patient versus practice member. My practice is a little bit different because people hang around for a while. They want to know what's going on. I don't know where in American history that doctor became deity in this culture. Whatever doctor says is it. That's not the way it is in my practice. This is the information age. Everything's open for debate.
Right.
People come in with stuff from the internet. Look at this. What do you think of this? Ooh.
Well, I think the tide is starting to turn a little bit, that people are becoming more responsible for finding out about their own treatment and their own
it's pretty awesome.
healthcare.
They're interested in options. And I'm not afraid to make referrals. I have people come to me, hey, what do you think about acupuncture as an example? I'm like, well, I know very little about it, but I have a colleague that's a master at it, so why don't you go check him out? Or massage, or a reflexologist in town. I make those referrals. I have an MD that we have a good relationship with, and if people need medication, they do. That's okay. That means the body's been exceeded that far that it's necessary to put a serious intervention through there, or they need to undergo some treatment with me because things have failed.
But it seems like we always come back to, people see you when they're in crisis. Something's terribly wrong.
Yeah.
But we come back to maintenance so that they don't reach that point.
Right.
So again, what do you recommend if you see somebody and maybe they don't have a knee that's swollen up, they can't bend, or their back's in terrible pain, but you recommend people coming in as a course of health care, right?
Indeed. Sure. In the very least, it be mechanically checked out. That's what I do. Bone, muscle, nerve, joint. On that triad, I'm the mechanical guy.
So if someone is in relatively good health, and they have a few aches and pains as they get older, you get up in the morning when it's humid like this, and you feel a little,
Sure.
So can you, do you have like a maintenance program that'll
Sure.
help take care of those
Yes.
stiffness and all that?
In my clinic, the concept here that I try to relay to people is I recommend what you need and give you what you want. We're not pushy. We don't do anything. We want to work with you. We don't want to be, doctor above dictating to lowly patient. No, this is more like a conglomerate or a team approach. Where do you want to go? What do you want? Do you want nutritional counseling? Do you want to learn how to take the stress off and do some time management? I'm famous for that. Everything's time. I'm totally obsessed with time. That's just me personally, because being focused on time means I can maximize my efforts and maximize my time with my babies. That's important to me.
Sure.
And it takes the stress off, and that's what I do. So we develop strategies for the consumer, whatever they want.
And are there strategies that a person can use outside of your office? For instance, if they have, carpal tunnel or something that they, exercises and things?
Oh, sure. If treatment's warranted by me, I make it known. If it's not, I tell them that too. Always. That's probably how I kind of transition people from patient to practice member, because I kind of encourage them to do things at home. Well, do these exercises, do these stretches. This'll lessen your time with me, and it'll be cheaper. And that usually gets your attention.
I'm saying it certainly isn't you saying, come in and I'll see you for 20 visits and they'll cost you this much.
Sure.
You're making people be independent. You're helping them be independent and take care of their own health care.
That's right. We're just kind of guiding the ship into a different course, if that's what they want. If they go, you know what, I just don't care, just fix it and I'm out of here, and great, we'll do it.
Okay.